Inclusive Education Canada. We're going to, I have a PowerPoint that will show you the plan for the meeting in just a moment. But before we do, uh, we'll just introduce or have people say their name and where they're from who are here on your screen. So we'll start with Dulcie McCollum
Hi, good evening. Dulcie McCallum
from Halifax.
from Halifax, originally from
And
Vancouver.
we have another Halifax resident with us.
Hi, my name is Corey Simkoski. I am also in Halifax.
And all the way out to Vancouver, the other ocean.
Hello, everybody. Carla Brisher, Executive Director of Inclusion BC.
And Krista.
Hi, everyone. Krista Carr, CEO of Inclusion Canada, and I'm in New Brunswick.
Okay, so these are the four panelists, and I'm your facilitator for the session. And we have some Inclusion Canada staff members, Jeff Ferguson, Charlotte Pike, and Hassan Khan, who are supporting us in this project. So let's get underway. I'm going to share a PowerPoint, which will also give more detail on the plan for the session. So give me a moment here. Okay, so our topic tonight is partial day school attendance. And let me just stop because I think I opened the wrong file. There we go. Okay, and we're going to get to our topic, but I first want to just tell you that Inclusive Education Canada is in the process of activating 3 new websites during the last few months. The one at the bottom, Source for Inclusive Education, is complete, up and running. It has a variety of information sources about inclusive education that you can access. We're having a new Inclusive Education Canada website launch in a week or two. And we're really proud and happy that we've been able to develop and will shortly release a new inclusive education website in French. And it will be developed by Francophones in Canada and will feature information about inclusive education and issues and stories here in Canada. So those 3 websites are all things that you can follow up on and find more information on as we go forward. So tonight we're going to focus on a survey and report that we've developed that's entitled Push Out the Harmful Effects of Partial Day Schooling. And we did a survey in 2024 and we've just published our report. We circulated it to everyone who registered for the session, at least through the weekend. And it'll be available on our website if you didn't already receive it. Now, the plan for tonight's session is that I'm going to continue this PowerPoint and give you a quick overview of the survey and report. And then we're going to hear from our panelists, Corey, Dulcie, Carla, and Krista. We'll have a bit of a panel discussion, and then we'll take your questions and a question and answer session to follow. Okay, first, why we did this survey. Well, over the last number of years, we've been hearing increasing concern from families, parents, and others about partial day schooling. It's been raised by our provincial and territorial associations, and it's clearly a national issue. It's not a limited issue. This kind of thing is happening in many schools all across our country. But the fact is there's limited research on both the scale of this practice and on the impacts on students, families, and their schools and communities. So we wanted to do our survey to get a better understanding of what's happening and how it's affecting people. Now, our survey was limited in that it was online. It was information about completing the survey was shared through our usual media, through our provincial and territorial associations, and it probably was shared in different ways, perhaps more thoroughly in some places than others. So, you know, there is some uncertainty as to how deeply probed on a nationwide basis. But for this kind of research, I think this report has brought forward a number of issues that are timely and prepared us to develop a strategy moving forward. So in our survey, 164 responses were collected. The majority of the families that reported had their child was in elementary school, 57%. Most were male, 77%. And students, we asked people if they wish to identify the factors you see below. Racialized students, 16%, Indigenous, 13%, and newcomers to Canada, 2.5%. So that gives you an idea of the families that participated in our survey. Our focus in the survey was first, what led to the decision for partial days, what was done to support or accommodate the student before there was a decision made about a partial day, the impact on the student of this approach, and finally, the impact on parents and family. Now, survey results. Gender, you can see very, very heavy overrepresentation of males over females. Question, do you feel the school adequately addresses your child's needs at present? And overwhelmingly, the answer is no. 20%, just a little over 20% said yes. Did the school acknowledge disability-related behavior as part of the decision for partial day attendance? And in just under 60% said yes, and 40% no. Were additional supports or accommodations put in place before a decision was made to reduce your child's school day? And again, the majority, 60% of families said no. Supports and accommodations were not put in place before implementing a partial day. Now, when we analyzed the results of our survey, we came up with 6 major themes that describe what parents reported in terms of their experience. The first is that behaviors at school was one of the prime and the main reason that the school gave for instituting a partial day. Lack of resources was a major issue. Schools would say, we'd like to have your child longer, but we don't have enough educational assistant time, or we don't have enough teachers in order to do whatever needs to be done. So a lack of resources, and this message was delivered not just by teachers and school principals, but by people at district or division school board offices as well. So behaviors first, lack of resources, and then we discerned in our analysis of the feedback that there are educational challenges, barriers, and difficulties that are involved in the education system. First of all, challenges in traditional school environments. If schools don't adapt and take into consideration what it takes to accommodate a student, then they give up and say, you can only come for part of the day. Lack of opportunities to take advantage of all aspects of schooling was an issue. Lack of support for both teachers, school principals, paraprofessionals, and those who provide direct service to the child. And finally, difficulties and challenges with transition from one grade to another, but more especially from one school to another. Number 4, mental health and emotional well-being emerged as a major concern. Social isolation, peer relationships, when children don't attend school full time, these things suffer. And these are issues that parents identified as significant difficulties that they encountered. And finally, 2 other things that are more focused on the family dynamics. When a child only can attend school partial days, it clearly provides the necessity for parents to plan for the rest of the day. And in some cases, this happens without warning. Many parents have reported that their child goes to school, but they have to be on call. The school may call and say, come and get your child, such and such has happened. And, within a half hour, an hour, the parent's expected to pick up the child and then arrange for care, which in many cases is difficult if both parents are employed. And of course, that leads to the financial implications, disruption for families, difficulties that emerge from this unanticipated and in many cases debilitating effect of their child only going to school part days. Now, just a little bit of quotations from parents. One parent said, "I fear for the psychological trauma and damage that he will suffer attending schools in a system that does not want him, cannot tolerate his attendance, and makes him and our family feel unwelcome, unwanted, and like we do not belong." Another parent said, "On days when he'd really like to go to school, he gets extremely frustrated. He promises, 'I will be good,' and he takes it very personally, stating things like, 'They hate me. I'm too bad to be at school.'" And a parent who commented that her son's self-conflict concept was, "I'm a bad boy, I'm a mean boy, I'm an idiot, I'm stupid." These are rather extreme expressions from families and individual children about the effect of partial schooling on them. A couple other quotes. "The school tells us they do not have the resources to support them. Our child wakes up so distressed at the thought of going to school that we either cannot get them to go or they'll get sent home anyway. So we decided to keep them home. They wanted me to sign a form that they could contact police or child and family services if there was an incident without calling me first. My child was 8. I was a single mother at the time with no local family support. I went on disability leave because I was afraid I'd lose my job, which in the end happened anyways." So when we analyze this, our conclusion is that partial day practices pose significant challenges for students with disabilities and for their families. Families are overwhelmed as they advocate for their child's education, as they try to manage the lack of childcare options, and they have, in many cases, leave their jobs to provide care. The responsibility lies with schools, school systems, and education ministries must do what they need to do to provide support to schools. Their failure to address the practice causes significant harm, and they must make the systemic changes needed to support inclusive education. My PowerPoint here is acting a little different. So, next steps. Our report has been released just this last few days. It's in English and French. It's on our website. And our intention is to develop a national action plan at least a plan that parents and families can look to for individual advocacy for their child, for community activity and advocacy that might be carried out by a family support group in individual communities, and of course by our provincial and territorial associations that support families and organizations throughout their province. We need partners to make this work, and we certainly will welcome anything to do that. So here are the covers of our report again in English and French. And I do want to add just one thing, that there are other reports. The New Brunswick Child and Youth Advocate, whose name is Kelly Lamrot, has produced a report on this practice in New Brunswick. And one of his findings was that there really isn't really good information on this practice. And there's some real legal issues as to whether it's lawful. And we know that the BC, the British Columbia Ombudsman Office, is looking at this practice as well from a systemic basis. So that's a brief and very brief overview of our survey and report. It reinforces what we've been hearing, which is that parents and families are struggling with this issue. It's not just in one location, it's across the country, it's in cities, it's in small towns. And it's something that we need to deal with directly and find a way to do better as we move forward. And I'm going to close my PowerPoint now. And we're going to turn to 4 people who have specific observations about this issue. And I'm going to introduce them briefly. And if I don't provide enough introduction, they can supplement that. Feel free. We're going to have an open discussion among the panelists and then with you, our participants, when they after they've had their say about this matter. We're going to start with a parent, and he's a parent who lives in Halifax, Nova Scotia. He's a history professor at Mount St. Vincent's University in Halifax. He and his wife, Martha, have a daughter, Quinn, and I'm not going to tell any more of the story because Corey Swimkowski is going to do that for us. Welcome, Corey, and please share with people your experience with this partial day schooling option and how it's affected your family.
Thank you, Gordon. And I just wanted to thank everybody who's in attendance today. I know that there's a lot of parents in attendance who probably have children who are going through a similar process or similar experience as my daughter is. I also think there's probably a bunch of teachers and perhaps educational professionals in the audience. And so to them, I'd ask them to read your report because it really shows firsthand, I think, the impact of partial days on children and on their families. Now, I am the father of an 11-year-old girl named Quinn. Quinn is a sweet, inquisitive, kind young girl. She loves Peppa Pig almost as much, if not more, than she loves school. Quinn also has Down syndrome, epilepsy, a chronic heart disease that was surgically repaired, and she has a lung condition that means that whenever she gets a virus, her lungs fill with mucus and she needs ICU level care. And so for a long time, prior to the pandemic, we would spend 2 to 3 months per year at the IWK hospital, which is the children's hospital here in Halifax, with Quinn in the ICU or on the ward right before she was discharged. Now, Quinn's experience with partial days or with abbreviated days, at least in the beginning, started as soon as she began school at Rockingham Elementary, which is the school she attends. When she first started attending, she was asked to come late and she was asked to leave early. Not super early or late, 15, 20 minutes, but it sort of set a trend. She was also asked not to participate in a field trip. And my wife and I pushed back against this quite forcefully. When the pandemic struck, Quinn had been attending the school for 8 or 9 months. She, on the advice of her medical team, well, in the March of 2020, everything shut down, so she was at home along with all of her peers, and then her medical team recommended that she only attend school until we saw community spread, and that lasted from September until November of that first year of the pandemic, and then they suggested that she come home. In 2023, 2024, we got a note from our doctor saying that Quinn should return to school, but she should do so when she does this. Adults who work in close proximity with her should mask owing to the severity of her lung condition. At that point in time, no EPAs, the educational assistants who Quinn requires or needs to help support her during her school day, none of them would voluntarily mask. And we were told that they had no obligation to do so. Her learning center teacher masked for 15 minutes a day, so Quinn got 15 minutes of school per day in 2023-24, until the EPAs actually went on strike here in Halifax and across Nova Scotia. When that happened, other students who were part of the learning center were able to get a half hour of instruction per day. And so we pushed against the Quinn's 15 minutes and got her allotment up to 30 minutes per day. That was the situation for the 5 weeks of the EPA strike in Halifax in 2023-24. The next year, which is this school year, we still have a physician recommendation that anybody working with our daughter should mask. We submitted this recommendation the same day we got it, which was August 28th. We gave it to HRCE, which is essentially the school board that runs Halifax. We were not able to meet with the school to discuss this until late September. At a meeting the meeting was attended by her learning center teacher, Quinn's learning center teacher, the school principal, her regular teacher, along with 2 officials from the Halifax Regional Center for Education. My wife and I were both in attendance as well, along with an advocate from Inclusion Nova Scotia. And quite frankly, this meeting was a bit of a farce. One of the HRCE officials was there to tell us that they couldn't fulfill the medical recommendation. There was lots of gaslighting that went on in this meeting. We were told that doctors often try to influence school programming and they have to push back against that. We said this had nothing to do with programming. This was simply about protecting our daughter as per her physician's recommendation. We were told that the collective agreement allows EPAs to refuse to mask. We replied that the Halifax Regional Center for Education has an obligation to satisfy Quinn's medical accommodation, and that provincial, national, and international human rights law supersedes the EPA's collective agreement. The HRCE official told us, quote, "That's not how we see it," and that they could in fact deny my daughter's medical accommodation. They had no duty to accommodate. It seems clear to us that HRCE was trying to hide behind this collective agreement to deny my daughter's accommodation. Afterwards, in a debriefing meeting with the Inclusion Nova Scotia advocate, she confessed to us that she had never seen such blatant gaslighting and hostility from school officials in a meeting with parents. The result of this meeting was that her learning center teacher and her speech language pathologist both agreed to wear a mask for the half hour each that they saw Quinn every day. And so Quinn gets under 5 hours of schooling, classroom schooling per week. And it's under 5 hours because the speech language pathologist is only there 4 days a week. So on that day, Quinn only gets a half hour of classroom time. We finally complained to the head of the HRCE in November. Interestingly enough, the form that we were required to submit could only be faxed or sent through the postal service, through the mail, and this was the time of the postal strike. Thankfully, we live in the city of Halifax where the head office is located, so we were able to drive it and hand deliver it. The leader or the head of HRCE suggested that we look into what was called a student health partnership plan to see if Quinn could be medically accommodated. And this is basically a collaboration between HRCE and the Children's Hospital to come up with plans of care for medically complex children in classrooms. Now, at a meeting to discuss this, the HRCE officials, one of whom was the same as we had met with at the previous meeting in September, told us that often doctors change their recommendations as a result of meeting with the Student Health Partnership nurse. The tacit meaning behind this was a strategy that we thought would be deployed in our case, that they hoped that the doctor would change his recommendation to say that Quinn no longer needed to be protected from viruses and such. We were also told that we couldn't limit consent in this process, despite the fact that the form that you fill out says that you are able to limit consent. And we just wanted to try and confine the nurses' interviews to people who had firsthand experience with Quinn. Because if you were to see Quinn when she's not sick, she's not a sickly child. She's a very healthy, vibrant young girl. It's just when she gets sick, she gets deathly ill. After another meeting with the Department of Education, a Department of Education official, and the head of the Student Health Partnership Program, we were allowed to limit consent to just folks who were familiar with Quinn, and also so that my wife and I could be involved in this process. Now, we met with the Student Health Partnership nurse over the phone, and then we had a conversation with her and with Quinn's physician. She agreed that masking was a necessary accommodation in Quinn's case, and it was central to Quinn's plan of care that she developed. That adults who work closely with Quinn, who work right beside her, doing hand-over-hand instruction, should wear a mask. She was also a bit incredulous that it had to come to this, and that because all that was really required was for somebody to say, I will put on a mask while I'm up close working with this, child with a medical condition. I should also note here that my wife and I volunteered to supply any masks that were required. There would be no financial hardship for the school or for the EPA. All we wanted them to do was to put it on to protect our daughter. Now, the SHP, the Student Health Partnership nurse, developed a plan of care that recommended or that said that people who work with Quinn have to mask. And we thought after this was sent to HRCE that we would be in the clear, and we were brimming with excitement. Then we got an email from the very same HRCE officials that we've been dealing with throughout. They were going to have a curriculum expert visit to spend a day with Quinn to see how much support she needed, basically to see if she still required the 100% support from an EPA that she had before the pandemic. They were also clear in this email that even though we jumped through every hoop they'd asked of us, and even though their own Student Health Partnership nurse wrote in the plan of care that people should mask, there was still no guarantee that folks would mask to protect our daughters. So there's still no guarantee that Quinn will be able to attend school. And this is a process that's still unfolding. We have meetings with officials later in the week. At this meeting, we're going to find out, I guess, whether or not Quinn will be accommodated by the school board. They continue to present it as a matter of willingness on the part of staff to mask around Quinn, and they don't recognize it as a necessary medical accommodation. And so we're basically dependent on the kindness of not strangers, but of people who are familiar with Quinn, who work with her at the school. We're reliant on their generosity to protect her from diseases that can put her into the ICU. We're quite worried about this process. We feel that this meeting coming up might be a meeting where they basically tell us that she won't be accommodated. And so here we are then in the final week of February, 25 weeks into the school year. My daughter has a physician recommendation requiring a medical accommodation for people to wear masks around her owing to her severe lung condition, which is a part of her disability. And this has been in place since August of 2023. So we're one full school year and 25 weeks into another where this accommodation has not been met. Currently, Quinn is getting 4.5 hours of class time instruction, which is the most class time instruction she's had since she returned to school in 2023. Every time we think we've made some headway, we're told that there's another meeting to have, another hoop to jump through, and we get the feeling that HRCE is constantly moving the goalposts for us. When we think that we've done everything that we need to do, we're told, oh no, there's another form that you have to submit and another process you have to go through. And what I find the most frustrating out of all of this, the most frustrating thing here is that in my mind, all it would require, all that was necessary in 2023 was for one of the many EPAs who work at Quinn School to say, yes, I'll put on a mask when I'm working closely with her. It's still, frankly, I just can't comprehend why it has come to this and why it has taken 2 whole years. So.
Thank you, Corey. It's there are so many questions and things that we could ask you, but we're going to have an open discussion a little later. I'd like to hear from our next panelists, reflecting a little bit about the issues that come out of your story. And so I want to introduce you to Dulcie McCollum, who's a resident of Halifax as well. And Dulcie's an advocate. She's been working to advocate for people with disabilities for more than 40 years, if I might be brave enough to say that. And she's a former BC Ombud person and a former Nova Scotia Privacy Commissioner. And noteworthy is that she's the author of a new book that's called The Audacity of Inclusion, Fighting for the Equity or Equality of Persons Labeled Intellectually Disabled, published by Pearson and available through Amazon, among other places. So, Dulcie, can you just reflect a little about the issue in general and the implications for families like Corey's of this kind of reaction from a school system all these many years after the Charter of Rights and Freedoms and many other provisions have been part of our country's legal system. Over to you, Dulcie.
Thanks, Gordon, and thanks, Gordon, for inviting me. And I'm really pleased to be here tonight and welcome all the attendees to hear what this panel has to offer, and joining Corey and Carla and Krista to address this really, really critical issue. It astounds me the various iterations school boards can come up with over the last 40 years to exclude kids. So just before I speak a little bit to Quinn, and I note the time, so there are a myriad of issues, and I have 5 minutes to do 40 years worth of advocacy, but I want to start by saying that I think we're letting all children down by this kind of policy, not just disabled children, but all children. As Gordon's report from Inclusive Education shows, the kids internalize this kind of exclusion and experience the impact of being segregated and treated differently, treated as the other. And in my little book, I talk about how after the Brown versus Board of Education case in the United States, they started to do some research about how this internalization occurred not just for the racialized kids, but for the non-racialized children who realized that they had been kind of party to this segregated approach of those who are now their friends. And I suspect Quinn, who is a gregarious, outgoing little girl, has a number of friends who are wondering why she's in sometimes and out other times. So I can say, in my humble opinion, that this practice is completely legally and morally wrong. And I come to that conclusion based on what we didn't enjoy 40 years ago when I started doing these cases with the late David Vickers. We have found the bedrock foundational documents now to our advantage. We have the Article 24 in the Convention on the Rights of Persons with Disabilities. We have a constitutional guarantee of non-discrimination in the Charter. And we have provincial and territorial human rights legislation that prohibits discrimination based on disability. So many people think, well, international law, what does that have to do with anything? But I think it's important to just point out briefly that when the CRPD, and I was on the delegation to the UN on behalf of Canada as a special advisor around intellectual disability, that the ongoing proceedings, which took upward of 4 years, Article 24 garnered the support of all 193 countries that are part of the UN. And I witnessed firsthand that Canada, the federal government, who was obviously the head of the delegation, worked tirelessly, actually, with provincial and territorial counterparts to gain consensus on the language of Article 24. So even I noticed artificial intelligence, AI on Google, has it correct when it says that Canada consulted with provinces, territories, Indigenous self-governments, and Canadians with disabilities before ratifying the CRPD, the convention. And this is important because I think a lot of provincial governments or school boards say, oh, that's just the feds. They've signed on to that. But when Canada signed it in 2007 and then later ratified it in March of 2010, they did so as a federation and did so on behalf of its federated partners. So I think that's important for people to know. What Article 24 basically does, and I'll just summarize, is it provides a right to inclusive education. And it says that reasonable accommodation must be provided in ensuring that equal education. Basically, it uses the language of education on an equal basis with others. So I think what I'd urge you to read both reports, particularly even though it's a few years old or 8 months old now. The report from the child advocate, which when I was the ombudsman, we had jurisdiction over such issues. And I was very impressed with the report by Kelly Lamrick. It's user-friendly to read, and it really lays out the inconsistencies in the school board's approach to how they rationalize this partial schooling policy. To look at it in the bigger picture, and I think it's important for all of us to recognize this, and I might get teary if I start doing this, but historically, children were locked in institutions, and I did the Woodlands report, The Need to Know. I know all about children being locked in institutions. When we finally decided as a community to shut down large institutions, congregate settings, we had children with disabilities in the community. So we established segregated schools. And then we kind of moved along a little bit of mainstreaming and a little bit of this. And we started having special classes in neighborhood schools. And then finally, with New Brunswick largely being a leader, we started to, and BC in many communities, we started to see inclusion in a real meaningful way, where there was support in class or pull-out assistance. And yet now, voila, we're here with this partial day, which feels to me like we've gone full circle, because it's allowing school boards to essentially refuse education and segregate and isolate. And that is like an institutional approach in the community, which is astonishing. The policy of giving up by Kelly Lamrick has shown how this policy has not only persisted, but has escalated. School boards are getting away with it. And I think cramming in other children, like children in foster care, along with children with disabilities, is it going to allow them one day to try and claim that this is not discrimination based on disability? This is a pedagogical approach, which is what they always say. And I think what Gordon's report has done is push what Lambert found out with to give it a national perspective. So just for a few seconds, I'll talk a little bit about Quinn, and I can do that later as well when we're having a general discussion. When school boards argue under human rights legislation, and I think it is important to highlight the Moore decision in the Supreme Court of Canada, which has now been relied on as a precedent in Newfoundland with the Churchill decision. Carter is his name, Carter Churchill. And this is recent, within like the last year or so. And this is important because we have, I think, gone beyond the old Eaton decision, which is very outdated and I think is decided wrong, in my humble opinion. Sorry, Supreme Court of Canada. And but the reliance on a Human Rights Act as the approach to address this has obviously had good result in Moore, and even more in the Churchill decision. And one of the important things about Churchill was what was argued in that case. It was about a Carter, who is a child who is deaf, was the lack of resources. And even though teachers had put forward their plan of how they could address accommodation for Carter, the school board didn't even respond to what the teachers had put forward. But they did an access to information request after the case had concluded successfully in their favor in the Newfoundland court. And they found the school board had spent $682,000 to fight the case in the Human Rights Tribunal and at the court. And to say they lack resources, and then use that incredible amount of money to fight the parents and the child, certainly puts holes in their claim of lack of resources. I'll just briefly on, I would say that in response to the Churchill decision, the principals of Canadian Principals Association of Canada put out a statement about teachers. And it's worth looking at that report as well, because it basically said school boards are not relying on teachers enough, that they are the experts, they should be the moral guide in all decisions, and that in reaching what should be their due diligence to meet the undue hardship test, they should be looking to those who are delivering the service. In my opinion, and I'll sum up, Gordon, because I can feel you looking at me, that maybe I'm just chatting a bit too much, but in relation to Quinn, and Corey, of course, can correct me if I'm wrong, but she feels like a poster child to me. Why? Because there's no behavior issue. The accommodation is simple. It's not financially a burden. The parents have offered to buy the masks. The medical and nursing communities support this decision, actually mandate it. And to me, it's impossible to show that the school board could show that there's been any undue hardship. And in stopping there, I'm just going to say the school board must show undue hardship in the classroom in providing reasonable accommodation to Quinn. If they are unable to, even if they're able to show that, which I don't think in this case they would be able to, and they have to provide another alternative. They have to explore all other options and be able to document those options. And the test, as Kelly Lambert points out in his report, the test becomes a different test when you go home. You can't take the undue hardship test that was applied in the classroom and apply it when you provide a service outside the, what do we call it? The normative, the regular classroom setting. So I'd be happy to answer any questions and get the rest of my remarks because I'm a little probably over time too. Yeah, I think that's it. Thank you.
Thank you. Thank you, Dulcie. I think my internet froze for a few minutes, and if that should happen again and it affects the session, I'd invite Jeff Ferguson, who's monitoring things, to jump in and take over for me. Okay, I'd like to welcome Carla Verschoor. Carla is the Executive Director of Inclusion British Columbia, and she's known as one of the articulate and effective advocates for people with disabilities in our country. And she has quite a bit of experience working with families, and both on an individual basis and on a systemic basis in British Columbia. And Carla, I wonder what you can share your perspective in working to support families who are encountering the kind of difficulty and challenge that Corey and his family are.
Well,
over to you, Carla.
Thank you. And thank you for that kind introduction, Gordon. I'll try to not disappoint on those high expectations. But thank you for having me here today. And it's only the afternoon here, so I keep hearing you guys refer to the evening. So out on the West Coast, I'm joining from the unceded traditional lands of the Kakite Nation here in New Westminster. I really felt the need to acknowledge that, particularly today, as some of the information you were sharing around the gender imbalance in your slides, we see that Indigenous students and newcomers to Canada are disproportionately impacted by partial days and exclusion here in BC. So I'm not sure what that looks like in other parts of the province, but it's something that we're very much paying attention to here in BC. So for those of you on the call who don't know too much about Inclusion BC, we are a provincial advocacy organization. And I think for today, the most two important things to focus on is that we have an individual and family advocacy program, as well as we do systemic advocacy at both provincial and sometimes municipal, sometimes federal level, but predominantly in provincial government. And I have a mighty team of two, Carradine and Sonia. I know you're there. Frontline advocates that support 1,200 people throughout the year, with myself and Erica Cedilio, our director, doing overflow. And over half of those situations that we support have to do with families experiencing exclusion from meaningful education in the K-12 system here in British Columbia. So although there was 167 reports, I can add 600 a year to that number. And when we had the earlier version of the partial day report, I sent it to Carradine and Sonia and just asked them to read it to see where it really stood out for them and what resonated. And what they said back to me is that this entire report could have been any one of the 600 callers we have day after day after day here in BC. And it just resonated, like every story felt familiar. Every scenario felt familiar. As you articulated out those themes, again, were really representative of the themes that we have here. And it just makes me incredibly proud of both Sonia and Carradine and our team that we're there to meet families from a place of no shame, no blame, of kindness, to bring dignity and take on some of that emotional heavy lifting that are put on families unnecessarily as a friend and an ally to them. So very important work. I wish the numbers were much smaller than they are, but I just felt that that would be important to share, that there are a lot more than are represented in the survey, particularly here in BC. So knowing that we are small and we do what we can and we can't get in front of every situation, it was really important for us as an organization to create a tool that was able to help those families that may not have that time to reach out. So we have something called the Inclusive Education Handbook, and it's a 167-page guide to the education system in BC. So pretty much anything that you would need to navigate an appeal, your rights, themes and trends, and things that might work to help get your family member back in a classroom, we share. And last year, the Inclusive Education Handbook was downloaded 30,000 times in our province. Now, I'm not sure if people from other jurisdictions are downloading it too, but what that tells me is there is a huge need for support. And unfortunately, we're not large enough to get in front of all of it, but really encourage other jurisdictions to make sure they have similar tools to support people and families, because the problem is much deeper, I think, than we know. Another thing that we've been doing here in British Columbia for several years, a family organization who's one of our members, so I didn't say that in the introduction, but we have 70 members that are sprinkled around the province that do individual advocacy as well as provide disability supports. Our member, BC Ed Access, which is predominantly a family-driven organization, created something called the Exclusion Tracker. So they've been tracking the trend of partial days over the last several years. And then just most recently, they've partnered with the Family Support Institute to take on and continue that tracking. But the role Inclusion BC has played is when families have filled out the tracker, but we require some advocacy support to support their family member, the student, to get back into school, we come in and provide that support. And what we have learned is the number one event, or the number one intervention, I guess, if you will, I don't know quite the word to say it, to get a student back into the classroom is that you have a leadership team, a principal, vice principal leadership team at that school that is open enough to work with his teams to create a culture of inclusion. Like, it is that school-based leadership that is the number one determinant from our experience that helps students get back in the classroom, which really does make sense, because what we see is the most reason why people are not in the classroom. Definitely resources and educational assisting and staffing shortages are part of it, but I don't think it's the full story. And Dulcie, I'm so sad to tell you, but you probably already know we are in a vicious backslide here in British Columbia in terms of our numbers and our approach to inclusion. But there is a persistence of that medical model of disability that shows up in school-based environments over and over and over again. And for those of you, I'm sure most of you are knowing, but the student is positioned as the problem to be fixed. We're not really looking at those social or citizenship models of disability that really take into consideration the social and academic and environmental barriers that are around the student, which is where we'd all hoped inclusive education would really center our energy around. So we're still stuck in that old paradigm where we're putting the student as the problem to be fixed, which then creates this really strong power imbalance that Corey talked about, where like the labor issues and the needs of employees will significantly outweigh time and time again the needs of the students. So one of the main things that my team does when we go into school-based advocacy situations is cut through that noise and recenter the conversations around student-based solutions, right? Not to disregard that the other things are important, but that is not for a family member to figure out the HR issues in school districts and even within the school itself. There has to be that intentional focus on the rights of the student if a solution is going to emerge. So if you're like, there's been times where the student's name doesn't even come up, right? Where we have to be like, whoa, what are we here to talk about exactly? So that's the type I'm just trying to really share how far the focus on the student sometimes deviates. I also only have 5 minutes, so Gordon, just cut me off. Just you're the administrator, you can put me on mute. The other thing, and this is where really I, as the executive director, got very much involved, and it's when we started to see this shift in some of our mainstream media, where we were using criminalized language to describe age-appropriate behavior disproportionately about students with disability. And it wasn't really getting called out by anybody, right? Like, it was pretty normative. People are like, yeah, that's a problem. But for me, I was sitting there hearing that, and coupled that with the other trend that we see is that students have this punitive cycle built around them where they have to earn their education through checks and balances and behaviors, right? So no student should have to earn their education. And if they don't have the capacity or the support to earn their education, the response of our system is this punitive criminalized language where we're referring to, like in the slide, the 8-year-old is violent, right? And having worked with many adults, I know like firsthand the damaging impact that has on people's sense of worth and identities. And to that point too, is what is that teaching every other student in that classroom? And Dulce, you talked about that, is that students with disabilities don't belong. It's okay to other them. And there's 2 sets of rule books, one that applies to me and one that applies to them. So inadvertently and unintendedly, that is what we're teaching our future citizens about disability. So that's what I have to say about that. There's plenty more, but I'll stop there. But I think the other piece I really like to focus on is the systems advocacy that Inclusion BC does. And I think it's really important for all of us that do that work to really stop and check is where are we putting our energy and where is it serving students with disabilities and where are we being complicit ourselves? So for many, many years, we sat around tables with our Ministry of Education around the inclusive education policies that were going to solve all of this, while each budget came out year after year with investment. But when you talk to the minister about the way the spending's happening at the district level, here in BC, we have 60 school districts, which I think is important to acknowledge too, because that means we're doing 60 different interpretations of things, which is challenging. It was always the autonomy of the district. Sorry, that's the autonomy of the district. So we didn't really have this strong provincial commitment to inclusive education. So it was around this time last year, actually a little bit more like maybe December, where Erica and I sat down and we're like, we can no longer be complicit and show up at those minister tables anymore. We're part of the problem because if we keep showing up, they're going to keep saying the same things. So we made the bold move to step down from all government consultations and put all of our energy to reactivating a rights-based framework around inclusive education. And that meant we started reaching out to the ombudsperson, to the Human Rights Commission, started authoring op-eds and articles with a very different lens than we had. And we were going to manifest what we wanted to be we started, the difference between us and New Brunswick as well is our representative children and youth doesn't have mandate over education. So we really have a huge accountability gap. So really putting all of our energy into that. And I was so happy that you mentioned it, Gord, but the ombudsperson has committed to doing an investigation into the exclusion of students with disabilities, as well as the Human Rights Commission is still interested in doing an inquiry as well. So I think it's really important as provincial and local organizations to take that step back and be like, if I keep doing things the same way I've always done things, am I being complicit in things being the same? And for us, it was a really important lesson that at that point, I think we were. But that must be 5 minutes. And Krista, you still need to talk, so I'll stop there. But looking forward to the conversation and the questions to follow.
Okay. To our final panelists, and I think each of the previous speakers did take just a tad more than 5 minutes. But Krista, would you like to wind up? Krista Carr is the CEO of Inclusion Canada and has been active in this effort to make schools inclusive for more than 20 years and knows a lot now about the national perspective. And I wonder, Krista, if you could kind of focus on that very fact, what kind of national issue this is and what you're hearing from people all across the country, aside from we got on the Nova Scotia, British Columbia perspective here, one coast to the other, but there's a whole lot of Canada in the middle. And we'll rely on you to give us a sense of how this issue plays out on a national basis. Krista.
Thanks, Gordon, and thanks to everybody for being here and for all the esteemed panelists I get to share this evening with. I guess, as Carla had mentioned, for those of you who don't know what Inclusion Canada is or who Inclusion Canada is, we're a national federation. We have 13 provincial territorial associations and over 300 local associations across the country. And we work to advance the full inclusion and human rights of people of an intellectual disability and their families across all aspects of a lifespan. And we all know how fundamental our school years are to that. Kids who are included in school are much more likely to be better included in life after school. And that's a fact, and it's well documented. And it isn't just for people with intellectual disabilities either, by the way. And it is a little bit of a challenge as a national organization because it's the one strategic priority area that we have at Inclusion Canada that is fully and totally in the jurisdiction of provincial and territorial governments. We tend to be working on issues that the federal government either has full or at least some partial jurisdiction over. And that isn't the case necessarily with inclusive education, except as Dulcie pointed out, let's not forget the United Nations Convention on the Rights of Persons with Disabilities that Canada has ratified. And as I like to remind the UN committee whenever they're doing the review on Canada, they can't hide behind federalism because every province and territory had to sign off on that. So they can't now pretend that they don't have anything to do with it. And what about, from the perspective of partial days, or this practice of, we're calling it partial day attendance or partial day programs. It can be everything from, I'm the one who gets the telephone call every morning to pick my son or daughter up at school, or every afternoon, or whatever, to it ending up morphing into some sort of modified schedule. And it's been a practice we've been hearing more and more and more about from our provincial territorials, to the point where we decided we would do our own national survey to get a bit of a handle on what this looked like across the country. And we did that work. We were doing that work actually almost at the same time that the report came out from the Child and Youth Advocate in New Brunswick, where I happen to live, Kelly Lamrock's report. And obviously, as we've linked it in the chat, it's definitely worth a read and is obviously highlights the situation in New Brunswick. But as we're finding, it's not different across the country. And whether or not the practice is becoming more and more prevalent, or whether it's becoming just more and more talked about and more known, but it's definitely coming more to light. And it's concerning, but what's worse than the fact that it's concerning is it's illegal and it's morally reprehensible and it needs to stop. And I guess I can't put much finer a point on it than that. And we showcase an experience today in Corey's family with Quinn, and that is one particular form of exclusion. But I know there are many of you across the Zoom screen saying, well, for my child, it's behavior. It's got something to do with their behavior, and we see that a lot. And what we often forget about is that behavior is a form of communication. Behavior is the way that we communicate, and it's particularly even more prevalent for kids who don't communicate in traditional ways. It's often their only way. And very often what we find in the systems across the country is there's really no acknowledgement of that, no sort of, how do we get underneath what's happening, what's driving behavior, what's the behavior telling us, what are the triggers for the behavior, and how do we support that student, the teacher, the environment, the school, all of that. So we talk about, it's often sloughed off as, well, we don't have the resources. But interestingly enough, we often don't even stop to identify what resources would actually be required in this particular situation. And did we ask for them? Did we try to get them? Did we try to find them? And often resources don't always mean we add an adult to the situation. It could mean support from experts or specialists. It could mean advice. It could mean some behavior mentors. It could mean support for the classroom teacher and strategies. It can mean all kinds of things. But it's just way too oversimplified, and it's becoming very simple to and accepted that we remove the child from the classroom or the school altogether and send them home as the appropriate response to this. And what we end up with is a substantive impact on the family, an irreversible impact on the student. And I would really want to make sure we point out a very negative impact on the rest of the students and the larger community at large. Like, that cannot be understated, particularly what our actions are saying to all the rest of the kids in that school or classroom or in those classrooms. And so, to just wrap, what I want to say is at Inclusion Canada, we're committed to working on this issue in conjunction with our provincial territorial associations who are driving things on the ground, who are doing the work, who are answering the telephone calls, and some of them are stretched for resources, even more so than Carla's talking about. At least she has two bodies. Some don't have that many resources. So we need to find the ways to ensure that families understand their son or daughter or child, identity, whatever identity they identify as, have a right to be in school. They have a right to an inclusive education with their peers. And the system has a duty to provide that. Now, that system needs to be supported, and we all need to work together to make that happen. And we really need to be working on, as one of the things we've talked about in our report, a national advocacy strategy around this, and maybe even a national legal strategy around this issue as we move forward. And just, I guess, finally to say we are committed to doing that, because it is really important that all kids have equal access to an inclusive education with their peers, and no matter at what age or stage across the country. So thank you.
Thank you, Krista. I'm going to amend our plan. We've heard from 4 articulate panelists who have different perspectives, from parent Corey, advocate Elsie, and provincial association person Carla, and then Krista with her national perspective. But what I'd like to do, I think, is just open up to questions that have come in from folks. And along the way, our panelists will be able to respond to those questions and maybe make a few follow-up points that they think are pertinent. So I'm going to ask Jeff Ferguson, who's a staff member with Inclusion Canada, to I think turn his camera on and maybe share some of the questions that have come in during the last little while. And thank you for staying with us as we get to this point. Jeff, do you have any questions that we might be able to
There's a
ask our
few
panelists
questions.
to
There's a
comment
few
on?
questions. I'm going to start first with a statement because I think it's important. Uzma says, Corey, thank you for providing a parent perspective of the reality of what parents whose children are medically complex or of a different ability face within the school system, especially for the right to education that is rightfully the child's, and these systemic barriers do not help. So I just wanted to get that out of the way, Corey. Question I think I'll start with is from Teresa. She's from Ontario, Peterborough. And she was a keener, actually sent in a question earlier today by email. She also put it in the Q&A, but I guess I'll start with hers. And her question is, I'm curious. It is a person's right to education, but if a parent receives a call from a school to pick up their child or youth due to behavioral concerns, as an example, does a parent have the right to say, well, I can pick them up at this time, not to automatically drop everything to pick them up at the time that they ask to be picked up. And I would also like at that time to ask them to request a formal meeting to discuss how the school can best provide the supports for my youth or child. So the question really is around, does the parent have the right not to drop everything at the instant that the school says, come and pick up your child?
Okay. I'm a former school principal, and I'll tell you my answer is that yes, parents do have a right to say that. I think it's completely unrealistic for a school to expect parents to automatically just respond quickly to that kind of call. Uh, Now, if it's an occasional occurrence and you get that call, almost all of us would want to respond and provide our child with support. But if it ends up being a routine kind of action by the school, I think parents are well within their rights to start to make clear what they can and can't do and what they're willing to do. Schools are supposed to provide education for the full school day to children, unless there's some good reason otherwise. And just to pick up and call the parent is not a responsible thing. I would find that quite surprising if many people. I think people do it because it's allowed to happen. I don't think there'd be too much surprise to know that they should not do that. Anybody else on the panel want to comment on that? Corey, what's your thought as a parent?
Well, we haven't had that situation occur, but I would think that there should be some flexibility because parents have schedules, parents have jobs, parents have obligations, and it's difficult to drop everything for the with in a situation where it seems that it's more for the school than it is for the child. If your child is injured or hurt or something, then you would drop everything, obviously. But if it's something where they just want you to take your child home because of whatever behavioral issue that's occurring, as long as the child isn't in danger, there should be some sort of flexibility on when you go to get the child, in my opinion.
Yeah.
I'll see.
Just to add to that, and I'll go back to something Carla said about always keeping our eye on the child being at the center of any action or inaction. And from my experience, my fear in a parent refusing to jump when the school board or the school says jump is twofold. One is I would fear that they would manage it themselves, but not by retaining the child in the classroom and getting a new support person to come in, but rather placing them in a seclusion room or segregating them and putting them even potentially at more risk. And the second fear I would have is that parents jump not because they necessarily think it's what's best for their child, but because they fear retribution from the school board and from the people there. Because I know that, and sometimes it builds on, like as Corey has experienced, um, they jump and then they do something and then they're required to do something else, and then the high jump keeps getting higher and higher with more things required to be done. So I think a parent would have to be very careful. I mean, it's curious to me that parents can be charged for truancy if they don't send their children to school, but schools can kick children out, even children who are in care, and nobody gets charged. It's always been a curiosity to me. I mean, maybe a school should be charged with truancy, but I would caution parents about that, and certainly I would tell them to document. Why are they asking to come and be picked up now? Why are they? What's their rationale, and what's going to be the option if they're not able to come because of their own work requirements or other family commitments, and document it all.
Jeff, another
Another
question?
question. Courtney asks, I apologize if this has been covered already, but does the use of partial day attendance also include coerced dismissals, where parents or caregivers aren't asked to come and get their child directly, but rather the school's guilts parents or caregivers to pull their child out of school due to behaviors or distress? I think the answer is
Krista,
yes.
Can
Well,
I go
no,
first?
Krista's getting a
I was going to say let
It's
Carla
fine.
go because she's on the ground with. I used to see this all the time when I was doing parent advocacy in New Brunswick. But you go ahead, Carla. You're right up to date.
It's the most common kind, in fact, right? Where there is so much a culture of silence and manipulation that, if we don't have to document it, if it's parents' choice, then it's quite accepted, right? So I would say not only is it common, I would say it's the most prominent strategy for excluding children with disabilities from the classroom, and is very, very prevalent here in BC, and I'm sure everywhere else in the country. Um, so absolutely is the answer to that. Was there a second part? I'll let you answer if there was a second part that I missed.
Nope, that was it.
okay. Something else. Yeah.
From Shauna, thank you for this insightful discussion. My question is, if these practices are blatantly against children's legal education rights and are illegal, how are schools getting away with this? What can parents and advocates do?
Krista, how about you go first on that?
Yeah. So what you're seeing from more and more reports, it'll be interesting to see what the ombudsman in BC says. But certainly, what you're seeing from the legal analysis that's done by the Child and Youth Advocates Office in New Brunswick, and there's lots of human rights tribunal jurisprudence and other legal jurisprudence around this, that it actually is the issue where we have is it's not really been challenged in the, not very often parents do not have the resources to hire lawyers to deal with these particular situations. And I will say, very interestingly, um, I happen to be married to a lawyer who often will get phone calls from families, and all he has to do is write a letter to the school, and all of a sudden the problem is miraculously solved. But it has not been able to be solved up until that point. So I think we haven't had we certainly haven't a Supreme Court case recently around, and certainly not around this particular issue. And what's happening is it's not being challenged legally very rarely. And when it is, what my experience has been in the situations that I've seen, it just quickly gets resolved so that it never does have to go any further where it would be in a position to set any kind of legal precedent, right? That then they would have to follow. And at the end of the day, I mean, it goes without saying, families should not have to go to those lengths to be able to have their children attend school.
Krista, what do you think the factors would be that could have us create a national legal, funded legal strategy to address some of these issues in a way that would provide some precedents?
Well, I think that's the work ahead of us. Like I just mentioned, I think we need to get some heads around a table and really, I mean, Dulcie's here, and there are many others out there that I know would be very interested in having these types of conversations and seeing what we can do from a legal perspective on this particular front. Again, gets a little bit more challenging because of provincial jurisdictions and these types of things, but I think it's definitely part of the strategy going forward.
I had one thing
Sorry,
on.
go ahead, Carla.
I don't want to go before
Sorry.
Cory, but I think the other thing that I think is really important is that most of the processes of appeal that are available to parents are very lengthy. And the priority is getting a meaningful education for your child as soon as possible, because that's the priority, right? So it is almost sometimes the path of least resistance to get your child back in school is where you're putting all your energy. So sometimes if you come to a school-based meeting, I've seen districts come with their lawyer team, and it's very intimidating for families. So what they want to put their energy into is getting their family member back in school and access to a meaningful education. And they don't have much energy for a lot of that other bigger fight sometimes. Sorry, Cory, I didn't mean to cut you off, so I'll stop.
Oh, no, yeah, I don't think you cut me off. I think Gordon was going to ask me a question. I don't know what he was.
Well, I'm just going to,
No.
I mean, you're faced by this right now
Yeah.
because like there's getting a solution or fighting the fight and maybe getting something down the line from a human rights commission or a court
Yeah.
that would satisfy you and also serve
Yeah.
as a something going forward as a
So
precedent.
yeah, we have got a human rights complaint ready to be submitted, but we haven't done it yet because we're still waiting for the process to play itself out. Uh, we're not sure if the human rights process will get Quinn back in the classroom in a timely fashion because that is a lengthy process in itself. We have, thanks to some assistance from Inclusion Canada and Inclusive Education Canada, made contact with legal representation. So we're prepared to go that route as well for Quinn, but we don't want to. Like the other panelists are saying, our priority is to get Quinn into the classroom in a way that fits with her doctor's recommended medical accommodation. And so we're hopeful that this meeting uh, this week will be another step in that path, and maybe even the final step, but we're not sure.
Right, right.
But we've done everything we can. We've on the advice of our legal representation, we went through the whole student health partnership program because he said, you have to jump through every hoop they make you jump through, so they can't say, well, this case shouldn't go forward because they haven't done the actual process that we want them to do. So we're doing everything that
Right.
the school board wants us to do, and then if they still refuse to accommodate Quinn, then we'll see what happens.
Dulcie, you were going to jump in here.
Yeah, no, I was just going to say that the great majority of all the cases I've been involved in since the 80s, the school board always folds at some point in order not to set themselves a precedent or for it to garner too much public attention, so they can continue to piecemeal include people without any systemic change. In the Moore case, for example, they pulled their child and sent their child to private school, and at the end of the proceedings, got reimbursed for their additional costs in the hundreds of thousands, I think. And in the Churchill case, they also they kept their child in school, but they claimed for their legal expenses, which were reimbursed, which were obviously sizable. In my opinion, which preceded the Eaton case, I didn't think the Supreme Court of Canada. The problem for us is judges don't go to school with children with disabilities. They don't have friends with disabilities. They don't know people who are intellectually disabled. There may be the odd one, but a court would be hard pressed, I think, to find the constitutional challenge, which is exactly what happened in Eaton. The good news for the people who are participating tonight, I wasn't involved in the Eaton case, but the other cases that were good precedents, like the Luke Elwood case in Nova Scotia, my opinion was the courts weren't ready. I think the human rights tribunals are ready, and they're the more likely route to success. That's not a legal opinion. It's just from the scan of looking what the decisions are coming out of that forum. It's definitely time for the ideal case, which is why I called Quinn. Her case really, it's not going to solve it for some children who are, but I think you may be able to get a precedent out of it that would serve a lot of children, because the school, the process that Martha and Corey have undertaken has been so extensive, and they've been so patient, and they are so articulate and well-informed advocates for Quinn. And the school board's position is so dramatically unreasonable and almost like a scam in some ways, the way they've approached it, particularly certain individuals who won't be mentioned. And the fact that there's backing from the province. I think one of the problems that we could address head on as a national organization or organizations is unions. Unions purport to be human rights leaders, and yet time and time again, school boards say, well, we'd like to do more, but our members won't wear masks, or our unions won't do this, or our members won't do this. So I think that's something that we should address, and I think we should address it at the national level through like the Canadian Labour Congress.
Good idea. Now I'm going to see if Jeff has one last question.
Yep.
And maybe we can have one panelist respond, and then we got to wrap up because our time has gone, even though our panelists only spent 5 minutes each talking, but somehow our 90-minute session has gone by so quickly. Jeff.
Yeah, so this question, there's actually about 3 that are kind of similar. So let's try to get 3 out of the way. There's actually 39 questions, so a lot of interest from folks. But this question actually deals a little bit with Dulcie's comment about judges. There's several questions talking about the recent issue in Alberta. I'm just going to read this one question that speaks to the other 2. Any plans for action in Alberta, especially since currently Hold My Hand Alberta is suing government for access to education connected to the EA strike in Edmonton? So I think there was a recent judge's decision on that is fairly positive, but I'll throw that back to you, Gordon.
Okay, Chris, a very short comment because you might have some insight into this, and then we're going to have to wrap it up. Krista.
I'm not sure that I do have a lot of insight into this.
Okay.
What I will say about the judge's decision that Jeff just referred to is that the EAs are on strike in Alberta right now. And as we know, across the country, we've seen this time and time again, including here where I live, that when EAs go on strike, kids with disabilities don't get to go to school. Well, there was an injunction filed by the families filed for an injunction, and the judge said, yeah, it's not okay. I'm paraphrasing, but basically said, yes, it's not okay to not educate kids with disabilities just because the EAs are on strike. And so the department has until Thursday to change the ministerial order or the injunction goes forward. So, I think that's a positive development and one that could really help us across the country. Like, that is groundbreaking. Right. And if you read the judge's decision, which most of you will, I'm sure, not want to do necessarily, but we should do a blog on it or a something on it, because I think that we can use a lot of that, a lot of what the judge says about the discrimination, et cetera, et cetera. I think it's applicable to other areas, including this one. That's my non-legal opinion on that. And I think that's something we have to look at.
Okay, thank you, panel. Thank you, Jeff. Thank you, everyone. We're not going to stop with this webinar to focus on this issue. So Inclusion Canada and Inclusive Education Canada, and I think we can say our provincial and territorial members are going to continue to look at how we can address this issue in a systemic way that'll make a difference to families like Corey's family. And it'll take some time, but we need to focus on this issue the same way that we focus on closing children's institutions and closing special schools. So let's work together, and I'm really pleased that so many of you have turned out, and most of you have stuck with us through the hour and a half. Thank you so much. Stay tuned to Inclusive Education Canada and Inclusion Canada, and we'll be following up on this and other important topics with webinars and information that we can share through our websites. So thank you, everyone, and have a good evening. Or have a good, and especially I can say that to Carla, because for some of us in the East Coast, the evening is well advanced. But Carla's just going to now get to spend her supper hour and evening, I'm sure, in beautiful BC sunshine. Thank you all. Good night.
Thanks, everyone.
Thank you, everyone.